your student. I'm going to be performing a head-to-toe assessment. Do I have your consent to continue? I'm washing my hands. Can I get your full name and date of birth?
Harley Brown, 3/26/2002.
And where are we right now?
The hospital,
What year are we in?
2026.
And who's our president?
Donald.
Patient is alert-oriented times 4. Are you having any pain today? No pain? Okay. So I'm going to go ahead and start with my assessment. So I'm first going to assess the patient's skin. Patient's skin color is consistent with ethnicity, no lesions, no masses, or abnormality noted. I am now going to continue to inspect the patient's scalp. Patient's scalp is clean, dry, intact, with no masses, no abnormalities, no lesions noted, and hair distribution is even as well. I'm now going to assess the patient's nails. Patient's nails. Patient's nails are clean, no abnormalities noted, no clubbing, capillary refill more than 2 seconds. I'm now going to move on to inspect the patient's head. The patient's head appears to be symmetrical, no lesions, no masses, no abnormalities. I'm going to assess the patient's facial symmetry. Can you smile for me? Patient's facial feature symmetric without any abnormalities noted. I'm now going to assess the patient's pupils. Please look ahead for me and shine a bright light. Okay, patient's pupils are round, equal, and reactive. I'm now going to assess their extraocular movements, so if you could please follow my finger, okay? Patient's 6 cardinal signs intact, normal. I'm now going to assess the patient's ears. So, both patient's ears appear to be dry, intact, no abnormalities, no masses, no drainage, or lesions noted. I'm now going to inspect the patient's ear canal with an otoscope. Alright, patient's ear canal appears to be dry, intact, with no lesions, no drainage. Tympanic membrane is pearly gray with no perforations noted. I'm now going to assess the patient's hearing capabilities. I'm going to perform the whisper test. I'm going to stand behind you and whisper a word, and I need you to repeat that word for me, okay?
Pink.
Perfect. Patient's whisper test passed. Patient's ability to hear sound is normal. I am now going to assess the patient's Meniere's patency. So I'm going to ask you to occlude one of your nostrils with your right hand, or left, whichever one. All right, take a deep breath. Great, and do the same thing on the other side. All right, Meniere's patency intact. I'm going to assess the patient's nasal mucosa. Patient's nasal mucosa is moist, with no lesions or abnormality, no masses, no drainage. The nasal septum is at midline. I'm going to now assess the patient's oral mucosa. If you could please open for me. Okay. Patient's gums and mucosa is moist, pink, and intact with no lesions, no masses, no abnormalities. Patient's soft palate and hard palate is intact as well with no abnormality or lesions. Uvula is at midline. Can you say ah for me?
Ah.
Okay. Yes, uvula at midline with voice percussion. Can you protrude your tongue out for me? Okay. Patient's tongue is at midline with cranial nerve number 11 intact. And patient's tonsils are not present, making it a grade 0. I'm now going to assess the patient's neck. So if you could please, there we go. Patient's neck is symmetrical with no lesions, no masses or abnormalities. Can you please look up for me? Look down, look to your left, and look to your right. Range of motion of the neck intact as well. I'm now going to also take the patient's carotid artery for Pruitt. Alright, no Pruitt auscultated with, over carotid arteries with auscultation. I'm now going to stand behind our patient and assess the patient's thyroid. Can you swallow for me? Alright, thyroid appears to be at midline with no deformities and no nodules noted. I'm now going to palpate your nodules of the neck. Patient's nodules are present with no enlargement or swelling noted. I'm now going to move on to the thoracic assessment. Patient's respirations are even, labored, breath, chest equal rise and fall, and symmetrical. I'm now going to also take your breath sounds. Deep breath. Okay, I'm gonna let you relax a little. All right, deep breath. All right, posterior breath sounds equal with no abnormal breath sounds, clear. I am now going to move on to the patient's cardiovascular assessment. I'm going to palpate your apical pulse, located at the mid-clavicular line, the fifth intercostal space. All right, apical pulse intact with heart rate at 76 beats per minute. No abnormalities noted. I'm now going to also take patient's heart sounds. I'm going to start with patient's aortic valve, which is located to the right of the second intercostal of the sternum in the second intercostal space. Then I'm going to do the pulmonary valve, which is second intercostal space to the left of the sternum. Erb's point, which is third intercostal space to the left of the sternum. Tricuspid valve, which is located at fourth intercostal space to the left, and then mitral valve, which is located at mid-clavicular line, fifth intercostal space. S1 and S2 are present with no gallops or heart murmurs noted. I am now going to also take for edema of the extremities. No obvious edema noted with inspection of the extremities. I am now going to palpate. No pitting edema noted with palpation. So I'm going to go ahead and move on to the patient's abdominal assessment. If you could please lay supine for me. I'm inspecting the patient's abdomen, the skin of the abdomen, patient's abdomen, skin color consistent with ethnicity, no lesions, no abnormalities. I'm going to move on to also take the patient's abdomen. Bowel cells are present and normal active. I'm now going to percuss the patient's abdomen. Percussion is normal with no dullness noted upon percussion. I'm now going to palpate the patient's quadrants, all four quadrants. Can you let me know if there's any pain? Pain? All right, I'm gonna go deeper. All right, upon abdominal palpation, no tenderness noted, no abnormalities, no masses or enlargements, and no tenderness. You can go ahead and sit up for me. I'm now going to assess the patient's musculoskeletal system. I'm going to start with inspecting the patient's muscles. I'm going to be inspecting the patient's muscles. Muscles do not appear to be, have any deformities, any asymmetry or abnormalities. I am now going to assess for strength. Can you pull, push? Squeeze my fingers. Push, pull, push on the gas pedal. There you go. Pull. There you go. Good. Patient's muscle strength is normal with no abnormality present. I am now going to assess the patient's range of motion. If you could please lift your arms up. There you go. Relax. Out to your side. Great. Can you flex your elbows for me? And then relax. Flex up and down. There you go. Do the same thing with your lower extremities. If you could raise up your hip for me, or your hip. There you go. Same thing with your legs. Okay, and then your dorsiflex, and good. Good. Patient's muscle range of motion intact bilaterally. I'm now going to assess the patient's gait. If you could please stand up for me. Go ahead and walk across the room. Come back. There we go. Patient's gait is steady with no abnormalities to patient's gait or posture. Arm swing was symmetrical as well with no abnormalities. And then finally, we're going to assess the patient's neurological system. I'm going to start by assessing the patient's facial nerve. If you could please raise your eyebrows for me. Okay, relax. Puff up your cheeks. Smile. Stick out your tongue. Close your eyes real tight. Okay, facial nerve intact. I'm now going to assess the patient's cranial nerve number 11. If you could please shrug your shoulders against the resistance of my, there you go. Look to your right, look to your left. All right, patient's cranial nerve number 11 intact. I am now going to assess the patient's deep tendon reflexes. I'm going to start with the brachial. Radial, patellar, and Achilles. All right, that has concluded my assessment for the day. Do you have any questions for me?